to parents, but I still share it anyways. But the whole thing with the perfect storm, just from what I've seen in the last 5-6 years of practice, is that parents are losing hope with the medical system, especially when it comes to kids with tough neurological challenges. And so finding answers and then actually having their questions answered is a really big thing. And so that's going to be the big thing tonight. We're going to go through quite a bit of stuff. Hopefully my dad jokes aren't terrible. They might be, they actually are. Hopefully I don't do too much science talk. I might, just because I get real nerdy with some of that. But these are going to be the big 5 things that we're going to go over. What the real root cause of our children's challenges are, what the actual heck is the perfect storm, and how does it relate to our kids. The things that birth trauma, the vagus nerve, antibiotics, and our brain-gut connection play into all of these things. The big one, which is real fun and sticky to talk about, is why real doctors don't talk about it and don't know about it. And then what other drug-free action steps that you guys can take for your family and for your kids to help them reach their full potential. So this is me. All the fun CV stuff I don't like talking about myself, but this is mostly for the providers. I own Haven Family Chiropractic, which is this. I have a focus on the nervous system, chronic health challenges, and then I have a specialty within pediatrics, prenatal, and family wellness. And so the big trainings are through the ICPA, which is where a lot of the pediatric and prenatal focus comes from. After March, Ashley, or future Dr. Ashley, will be the other Focus Academy certified doctor in all of Houston, which is a big deal. So it's not just me doing this amazing work. One of the things that my office is known for is the cranial work. So within the tongue-tie, airway, palate expansion sort of space, and all of that comes from the SOT pediatric practitioner specialty. And then there's not a cool certification through the Polyvagal Institute yet, but I am a polyvagal informed pediatric chiropractor. And so that plays a really big role, especially when we're talking about kids on the spectrum, as well as kids with big time like emotional regulation, not necessarily feeling safe within their bodies. So that's me. Again, I don't really like talking about myself, but this is my why. This is our son. He just turned 2 last week. I was already doing this work prior to him being born, but with his birth and how traumatic it was and how awful my wife's pregnancy was, he shouldn't be as cool as he is today. Like this dude is talking, he's never had an ear infection, no antibiotics, none of the things. And you know, when we start moving through this perfect storm pathway, you guys will start to understand that like he shouldn't necessarily be this dude on the right. And with all of my cranial background, looking at this left picture, his head is super jacked up. Our friend who's an OB actually delivered him, and she came in and checked on us. She actually wasn't working or on call that day, but we called in a favor. She came in, delivered him. Unfortunately, my wife had to have a C-section, which was not in our birth plan at all. But she came in and saw him like, I don't know, maybe it was 24 hours. We were both in a haze. But she was like, what the hell did y'all do to his head? Because it's like completely normal. And we were just like, Cody, what do you think that we did to his head? He got adjusted within the first couple of minutes of life. So, but this is my why. So after he was born, it didn't hit me from like the cesarean standpoint, especially when we start talking about antibiotics and all of those things. Because one thing that people usually don't know is that moms will preemptively get an antibiotic prior to a cesarean delivery, which trashes their gut before they even get here. So for him, he struggled with a lot of gut stuff, some immune stuff in the beginning, and his sleep was really, really terrible. And those are some of like the preemptive things of the perfect storm when we start to get into it. But it wasn't until like I kind of came out of the haze or drunk some coffee or something after we had him that I was like, oh there's kids in here. Oh crap. We've got to get on top of this because I know what's coming. And so this is something that I always share because it's a really cool trend that I've seen over the past couple of years is that, and I mentioned it before, is that parents are getting tired of the traditional medical system. I couldn't tell you how many moms that I've sat across the table from, knee to knee, heart to heart, eye to eye with, that are like, we're doing PT, we're doing OT, we're doing ABA, we're doing speech, we're doing all the things, and our kids aren't getting better. And so they're tired of it. And a lot of them will switch to more of this like integrative, holistic, natural medicine route where they're trading prescription medications for supplements with really no end date. That's usually the frustration that I hear from moms in the office. And then the lesser known is the more neurological route, or actually supporting neurodevelopment rather than suppressing it with medications. And that's where I like to talk. So this is a fun little video. If you've seen it, don't ruin it for everybody. But if you haven't seen it, basically there's gonna be two teams passing a basketball back and forth to each other, a team wearing white, a team wearing black. And so basically all that you need to do, and it'll instruct you to do it too, is just count the number of passes that the team in white makes to each other.
This is an awareness test. How many passes does the team in white make? Go! The answer is 13. But did you see the moonwalking bear?
So it's a silly video, but the meaning behind it is the big thing, because it's easy to miss something that you're not looking for. And if you remember, one of the first questions that I had is, why does not every provider know about this or talk about it with their parents? It's because they're not looking for it. They're not looking for birth trauma. They're not looking for stress stuck onto the neurological system. That's where we step in. So what is the perfect storm? I'm sure everybody has that question by now, seeing my pretty face all over Facebook and Instagram and all of the things. But the perfect storm is the sequence of stressors and sickness that our kids are going through at an exponential rate. And so it's not on there, but I'll go through it. There's a couple of other things within the folder that we'll give you, because there's stuff that you got to read on it. But it starts out with mom's mental emotional stress during pregnancy. There's a bunch of research that I'll share, because again, I'm a big nerd, about the impact and implication of mom's stress during pregnancy and how that impacts the developing brain and actually contributes to this cascade of events once they get here. This is one thing that I see in just about 70% of all of my, the term that I would probably use right now is neurodivergent population, but I'm seeing it more and more even just with some of the babies. The big things that I see, at least in Houston, depending on the age of the kid, Hurricane Harvey, the freeze in 2021, COVID, which we're still not done seeing the effects of that. And there's something else that is big. I can't remember what it is. But anyways, those big events during the prenatal period are something that I see on my intake forms time and time again, depending on the kid's age. And it's the one thing, and I'll hop on a soapbox real quick. We take care of moms pretty terribly in this country. I think that white men have ruined the way that we do birth in this country, and I'm not afraid to say it. But the thing is I say we, I don't, but as a collective within the birth community, mom's mental emotional stress and the stress load that she's under during pregnancy just kind of gets glossed over and absolutely dismissed, because every mom is stressful during pregnancy. And then we add fear-based obstetrics. If your baby is too big, we're going to induce you at 37 weeks, and then the story keeps on playing. That adds to mom's overall stress load. The big one that I see, which I usually just say, is the injury to the insult, because the stress is already there before they take their first breath. Then we add birth intervention on top of it. So inductions, epidurals, C-sections, forceps, and vacuums. And about 90% of all of the cases of ASD, ADD, ADHD, or I already said autism, big time emotional dysregulation, OCD, ODD, any 3 or 4 letter diagnosis that you can think of, that's what I see in almost every single case. I actually just did a new patient consult today for a 4-year-old that basically is this whole cascade of events. Mom was incredibly stressed during pregnancy, was an emergency C-section at 34 weeks, was in a NICU stay for about 2 or 3 weeks, and then at least 20 rounds of antibiotics between now and age 4, and they ask why she can't sit still or can't focus or can't regulate her emotions. It's a big part of why. And then what ends up happening and what I see, especially with these babies in the office, is that they're stressed, they're colicky, they're constipated, they're not eating, sleeping, pooping, or calming with ease. That's the foundation of neurodevelopment. And if babies are not doing that, it sets the stage for everything else to be altered thereafter. And then what ends up happening is that stressed out, colicky, constipated, uncomfortable baby turns into a toddler that's experiencing the exact same thing, except now there's gut issues, all of the ear infections, sensory issues, all of the emotions, and the ones that are constantly sick. I actually did a big weekly theme on my social media a couple weeks ago, and it was about antibiotics and the constant sickness. And I hear it from my parents in the office where it's like 2 to 3 weeks are like sick within the month, and there's like 1 healthy week where it's like the cough that just won't quit, the nose stuff that just, I mean, you can throw whatever at it and it's just not going away. And then those toddlers become the sensory spectrum hyperactive and emotionally stuck children. So this is grade school and then beyond. And then we have our exhausted and angry and anxious, depressed teens. I see this more so post-COVID than anything. And then there's us, burnt out, stressed out, anxious, and ADHD adults. Which there's hope for us. Sometimes it just takes a little bit longer, a little bit more work. But the big thing here and why it gets missed is the one thing that whenever we have these little babies and we're passing it off to that weird uncle at the family events of like, what's the one thing that we tell them to do? To like cradle the head and the neck. Why? Because it's the most delicate and underprotected area in the entire body. But yet we have no issue with a doctor using big plungers, big pliers, or big hands to pull them out of the womb space. Make it make sense. And so one of the big things that I always share, especially being a polyvagal informed provider, is the stress and tension or the physical stress and strain put on the upper neck and the vagus nerve is one of the biggest contributing factors to not just sensory regulation within our kiddos, but also the gut and the immune system portions of it too. Simply because the vagus nerve plays such a big role with socialization and emotional regulation. And so we question as to why those things are happening so much for these kiddos. Again, I love research. Here's a bunch of research. The one that's probably the most fascinating was this one that just came out early last year. And what they ended up looking at was they looked at cognitive performance in kids in elected inductions versus non-elected inductions. And their actual academic performance was significantly lower compared to their peers. It was interesting. It's fascinating. This is the big one that I like to share, especially when we start talking about big events. Project Ice Storm. So essentially what they looked at was, I forget where it was, but they were basically like snowed into their house for like weeks and weeks and weeks on end. And so what they ended up doing was more of a longitudinal study looking at the effects of cognition as well as their speech function up until about 5.5 years old. And the kids with the moms that were stuck, especially during their pregnancy, or those were just isolated for that period of time, had significantly lower cognitive ability as well as speech production or expressive language due to the amount of stress load on them and the isolation from other people. The one that I love that we're going to talk quite a bit about is this one on the bottom right, which is the review of the vagus nerve, autonomic nervous system during fetal development, and it's searching for critical windows. So why the mental emotional stress is probably the biggest factor, and I would probably put it a little bit higher than the interventions at delivery, is because of the things that happen while they're still in the womb. So at 4 weeks gestation, their organs start to develop. They start to get their body reflexes at 12. One of the things that I see and talk about with parents with sensory integration or sensory processing disorder is this central autonomic nervous system development at about 20 or so weeks. Typically what we're talking about is a mismatch of signaling coming from the body up into the brain. They just can't handle the processing. Then the big part of the parasympathetic nervous system starts to develop at 28 weeks. And the one thing that I share with all moms that come into the office, especially when we talk about mom's stress load during pregnancy, is babies will actually take on mom's vagal tone, or the activity of their vagus nerve. Babies will actually take that on at about 32 weeks gestation. So essentially, mom's stress load is being transmitted to babies throughout the 3rd trimester, on top of them bathing in stress hormones and feeling everything that mom feels. From like a mental health counseling standpoint, I know there's a couple in the room. The one thing that I shared, because there's a really cool course that my wife and I took, specifically looking at birth and labor from the baby's perspective, and actually their babies' attachment styles, or kids' attachment styles, are actually developed before conception. Things that are spoken over our pregnant moms prior to conception actually play a role with their attachment styles when they get here. It's nuts. It's nuts. I get real crazy about this stuff. And then once they're here, the autonomic nervous system's only role is to adapt and handle our external environment. One of my favorite quotes from this specific paper is that autonomic nervous system impairment may have consequences on global development that persist during infancy, adolescence, and adult life. Because essentially, the brain and nervous system is the first thing that forms in utero, and it's one of the few things that's stuck with us for eternity. This will be a thing that you guys have in your, I think it's on the inside of it. There's a couple of small things on here. But from a chiropractic standpoint, this is the thing that we've been talking about for 129 years, is the type of stress onto the body matters. So we spend a lot of time with physical stress, primarily from a birth perspective. Changes with in utero position, twins or multiple babies at the same time also plays a role with physical stress. We talked a lot about chemical stress. Facebook is always listening, so there's some things I won't talk about. But antibiotics play a role. Our air, our food, our water are all types of chemical stress, not to mention sugar and dyes and food additives and natural flavors and all of that fun stuff that we can go down a really deep, dark rabbit hole with. But the two that get missed that I see with almost every kid that walks through my office is the physical stress part and the mental emotional stress. And the reason being is because nobody knows to look for it. Nobody really screens to look for it. There are a lot of really great postpartum providers that are screening for mom's mental health now. But from a traditional obstetric standpoint, it's just not something that's looked at. So what we talk about within chiropractic is this idea of what's called a subluxation. It's one of the big things that's in the middle. And essentially, I say chiropractic 1.0 is the misalignment of the vertebra, or the things that are not moving correctly. That's creating extra tone and tension within the musculature, which is then creating irritation or altering signaling from brain to body and body to brain. The issue with this is that it actually contributes to the fight or flight response within our body. So essentially, when things aren't necessarily working correctly on the inside, it's going to add to our overall stress load. And so in chiropractic, when we talk about this term subluxation, all that we really mean is stress stuck onto the nervous system or stress stuck onto the body. And when we talk about that perfect storm pathway that we went through towards the beginning, the earlier and the more often that a child goes through those stressors, because stress is sticky and it accumulates, it pushes our nervous system deeper and deeper into a fight or flight response. And so far too often what I see, if you look at the little sheet, we have our sympathetic gas pedal, or that fight or flight side. We have the parasympathetic brake pedal, and far too often these kids are way, way too overly sympathetic dominant versus in their parasympathetic side. Why that's relevant is because our parasympathetic controls rest, digestion, growth, and development, whereas our sympathetic side is more of our fight or flight survival mode side. The quote that I love, which is at the bottom of that sheet from Dr. Bruce Lipton, is our bodies cannot be in growth and protection at the same time. We're not necessarily going to be worried about the food that we're digesting, or growth for that matter, if our brains are constantly perceiving that we're running from a tiger. There may be a couple of us in here that if a bear broke in, we're probably going to fight it. But most of us are either going to like run, we're going to freeze, or we're probably going to get eaten by a bear. But essentially, our brains can't tell the difference between these stressors. It just knows that there's stress there. Stress stuck on. That's what subluxation is. Another really one of my favorite quotes is another one by Dr. Bruce Lipton, the function of our nervous system. And if we talk about that vagal maturation study, the whole role of the autonomic nervous system is to scan our environment and actually predict if we're safe or not. It's funny, should I share that? I don't know, maybe not. Yeah, I probably shouldn't share that. But the function of our nervous system is to perceive our environment, understand if we are safe or not, and then go about our normal function. And then it's able to coordinate the behavior, and I like to say the function of all other cells, tissues, organs, systems within the entire body. So when we talk about altered perception or the altered signaling within the body, that's where we get back into the subluxation concept. So altered perception of the body, or where our body knows that it is in space, alters our function. And when we start talking about birth trauma, or we start talking about interventions at delivery, the motor system is impacted first. The most common thing that I see within my practice, especially with babies, and for a lot of the case histories that I take for kids on the spectrum or any of the others, is that they had a significantly hard time eating. So like latching, feeding, whether it's the breast or the bottle. That's where a lot of the tongue tie stuff can come in. That's another topic for another day. I have a pretty big soapbox about that. But the motor system is altered. And if you remember, the foundations for babies are eating, sleeping, and pooping and calming with ease. And if that doesn't happen, it alters everything else down this list. And we talked about birth trauma and its effect on the vagus nerve. We'll talk about the vagus nerve a lot later, but that's one of the biggest direct connections to our gut, as well as the immune system. And if our motor system and our nervous system is altered from those first three, speech, social, behavioral, and emotional regulation are going to be altered as well. The big thing is when we're talking about perception, we're talking about how our brain is receiving, processing, and then the output of information. And so if our brains are built from bottom up, back forward, left to right, inside out, and the signaling is not there, or the signaling is altered, the way that the brain grows is going to be altered as well. You guys have this in there as well. It's something that I share with parents. Yours has a bunch of extra stuff on it in terms of stressors as well as like functions of these parts. But this is something that I share with all parents that come into my office, kind of giving them an idea of one, where I start, but also what are the things that can be impacted from us addressing the foundational component here. So we talked a little bit earlier, the brain and nervous system is the first thing that forms in utero. Then organs, and then the rest of the body forms over that. But the thing that gets impacted the most, whether it's the physical stress, mental, emotional stress, is this. And then we add injury to insult, and then our motor system is altered, or the muscles or the cranial nerves that are involved with feeding and latching, suckling, swallowing. Then the gut and the immune system becomes altered. And I just call the top big brain function. So things like cognition, things like speech, socialization, emotional regulation. The one thing that I share with all of those is if the basic foundational pieces of eating, sleeping, and pooping and calming were not there, kids have to go back to master those first before we can get to those bigger skills, which is a lot of times where in some cases PT, OT, and speech doesn't necessarily get them there yet because they don't have a big enough foundation to then build off of. This is one of my favorites. Again, I'm all about research. This is from Harvard. So especially when we're talking about ASD, genetics are something that get brought up quite a bit, and this is what they have to say about genes. And so genes are essentially our blueprint. It's not the actual game plan, it's just the blueprint. Environment is the big thing that impacts genes. But essentially the the genetic expression will then change the way that our brain develops. I see a bunch of kids with Fragile X, which essentially presents like ASD. And so essentially the way that their brain has developed, regardless of if they're 5 or if they're 10, has been altered. So like cognitively, they usually kind of stay around 4 to 7 years old. But it's because the blueprint is altered because of the genetic expression. But essentially, when we start diving into it, cognitive, emotional, social capacities are, I can't say that word, intertwined throughout the life course. And the big one that they stress is that toxic stress on our brain and nervous system not only alters the architecture or like the structure of the developing brain, but the functionality piece of it as well. Going back to the genetics conversation, this is research done by Dr. Paul Hardy, who's a biomedical provider, specifically researching autism and neurodevelopmental disorders. And so what he talks about is that our genetics are only one piece of the puzzle, right? It's our blueprint. And ultimately, it's the health of these big 4 systems within the body that allow for our genes to express either positive and negatively. However, the environment, so our toxins, air, food, water, medications, maternal distress or the stress during pregnancy, intervention at delivery, malnutrition, a bunch of other environmental factors actually alter the way that our genes express into a negative way. And if the health of these 4 systems are not there, then it creates neurodevelopmental disorders or the expression of neurodevelopmental disorders. This is back from the Harvard study. On the far right is a slide of nerve fibers, or actually neurons, I should say, within the actual brain. So this is what normal looks like. You can see lots of connections over here. This is neurons under toxic stress within the brain. Very, very few projections. The one thing that they talk about within the Harvard brain discussion is they call it more of like a critical window. So I always share with parents that the brain grows the most in size within the first year of life. It grows about 200% within the first year. Within the first 3 years, they make more connections within a day than we do in an entire year. And then up until 7 is when, it's debatable, but up until 7 is where brain waves start to shift and change. So essentially the first year, but really the first 3 years are most crucial for neurodevelopment, whether we're talking about cognition, speech, socialization, etc. So whenever we start putting the pieces of the puzzle together, we have the perfect storm algorithm. So how much stress on that gas versus brake folder? I like to throw technology as a 4th T, so traumas, toxins, thoughts, and technology, because blue light, screen time, 5G, Wi-Fi, all of that stuff plays a role as well. And then when did the stress occur? So how early and how often did these kids go under this stress? Because that gives us a really solid idea is like what it's going to take to restore neurological balance within the system. You guys have this on the back side of the folder, just because there's a whole lot of small things. So when we look at this picture, typically from a Western medicine, traditional medicine standpoint, we read it from right to left. So there's symptoms, there's struggles, there's issues. However, when we go back and understand that our nervous system is the master control system of literally everything within the body, we understand that it controls all of the systems, which then create the functions. And if things are not functioning correctly, well, then it creates the issues. One of my good mentors talks about the neurospinal system, because most people think about chiropractic as back pain, neck pain, headaches, motor vehicle accidents, sports injuries, those types of things. But essentially the spine, or the bones in the spine, are the communication corridor to affect the nervous system. It's not the only way to affect the nervous system, but it's one of the most effective. And so what he shares is that the spine is far more than a bunch of ligaments and bones. It's a living, breathing, neurological communication superhighway that's vitally important to our brain, to our body, and then back again for communication, coordination, and control of every single tissue, cell, and system within our physiological system. So literally it controls everything. Our eating, sleeping, pooping, the things that we don't think that it controls, it controls. Going back to this concept of subluxation, because we're going to get into the science of that, because that's really fun for me. Maybe not for you, but it's fun for me. But subluxation, for all intents and purposes, is stress stuck on to the nervous system. So I like to go into the big science of all of the fun things. And so there's a 10D model of subluxation. We're going to go through the first 5, and then we'll go through the 5 after that. So the first 5, we have dyskinesia or abnormal motor movement. Thinking about it this way, whether it's in utero position or birth trauma or C-sections or forceps or vacuums, the motor system is altered first. The position of the bones in the spine are altered first, and then the movement of them. This alters the signaling or the input coming up into the brain and then input coming back down to the body. This is what's called disafferentation, or essentially dysfunctional or abnormal afferent input coming into the brain. If we're having abnormal input coming up into the brain, it's going to create a stressful response. It's funny because this is actually being used as a medical diagnosis now because basically doctors don't know what's going on, but it's a really big imbalance within the autonomic nervous system, or things are shifted and stuck very, very deeply into this autonomic or sympathetically stuck system. Then we have dysfunction, or the parts of the body not necessarily working correctly. We always look towards the key systems within the body. And then a really fancy term called dyskinesis. So if our body is stuck into stress and our motor tone is altered, we're not going to be utilizing energy as efficiently. And so this is the big fancy term for our body either using too much energy or wasting it, or being too exhausted. And both of those are not a good thing. This is a C-section video. If anybody does not want to watch that, I totally understand. I do share a joke with this. It's not about the C-section, but parents always come into the office and worry about me adjusting their kid or adjusting their baby. And then a lot of times this is how they come into the world. So this was a vacuum extraction as well as a cesarean delivery. So it's 2 of the big things in one. They did not pull our son out with a vacuum. He was pulled out by hand, and it did look very similar to that because I watched very intently. But the reason as to why I share this, one, to kind of make light of it, of parents worry about me adjusting their kids, but this is how they get here. But the big part is that it's easy to miss something that you're not looking for. The amount of stress and tension that's placed onto the upper neck when they're pulled out of the womb space is significant, and it alters the structures both neurologically and physically within the body. These are some rates of Houston, because the big graph thing that I have is not up to date. But depending on the hospital in Houston, 31 to 40% cesarean rates in the city that we love. And then Texas ranks number 7 in the top 10 states with the most cesareans. I've seen as high as 44%. I think that was like 2 years ago. That was also kind of during COVID, but that's besides the point. But essentially this stuff is happening more so than we really understand. And when we start going back to the genetics question, there's not been enough time, especially when we look at the statistics surrounding things like autism or ADHD, where there was this massive spike or jump after the 80s. It's not enough time for essentially genetics to play such a big role. So there's something environmentally or something physically that's going on. Again, I love research, so here's some fun research. Because I'm a cranial guy, I like to throw some of these numbers in there, but this is what they looked at with 100 healthy infants after delivery. 99% of them had dysfunction, or what's called subluxation in the chiropractic realm, to the cranium, 95 to the occiput, which is the upper cervical spine. 94% of them had dysfunction within the lumbar spine, 80% to the sacrum, or the base of the skull, or the base of the spine, sorry. What they found within the research was that the longer and more intense that labor was, the more instance of spinal dysfunction or subluxation that was actually present within the body. This is another really big one that they did several years ago. They looked at 1,000 infants within the first month of life. 80% of kiddos had a misalignment or a subluxation within the upper cervical spine. This is another one primarily surrounding birth trauma, a little bit larger sample size. 90% of the kiddos that they looked at within this study had big birth trauma, and then what's called strain. From an osteopathic standpoint, they'll call it strain, but we call it subluxation within our profession. But strain to the neck and cranium, 90% of the 1250, and then 10% had severe trauma. These are a lot of resources, if you like resources. These are primarily the prenatal and perinatal risk factors, primarily as it's associated with autism, but there's a lot of really big stuff here. So fun words, this is that third D within the pathway, or dysautonomia. So this is the imbalance to the autonomic nervous system. Biggest thing that we need to know here is that the amygdala, as it acts in our brain, is primarily for emotions. Our hippocampus deals with learning, and so whether that's short-term and or long-term. So one of the things, especially from a polyvagal standpoint, is that when kids learn that something is not safe, they don't ever want to go to it. It's like a triggered response within their bodies. And so if what they've learned is that everything is stressful and everything is emotional, of course the dysregulation then comes with it. And then one of the cool parts of the brain, which is one of the big ones that chiropractic influences, is what's called the prefrontal cortex. So this is the part of the brain that I like to say makes us human. So all of our attention, all of our executive function, a lot of the big things that makes us adults, like us being able to sit here and halfway register what I'm saying. That was a joke, again. Going back to the gas versus brake, and one of my favorite quotes is that our bodies cannot be in growth and protection at the same time. And we start talking about these kids and we wonder why motor development is not on board, or their speech is not on board, or their socialization issues with these kids. It's because our bodies is stuck into protection. They believe that everything is, or they perceive everything to be a threat. Everything is being pushed into survival. The vagus nerve is probably one of my favorite things to talk about because it goes basically everywhere. So originates from our brainstem as one of our 12 cranial nerves. It goes to the roof of our mouth, so our gag reflex, sensation of the tongue, our lungs, our heart, our digestive system. And so whenever we start talking about influencing the vagus nerve, that's where you can see some cool things of like kids calming down, or adults calming down for that matter, as well as improvement to the way that the digestive system functions. There's a couple of cool research studies around that. So this is one that they looked at primarily with sensory processing, or what they call in the research sensory modulating disorder. They used a tool that's called heart rate variability, which basically just measures the amount of stress load onto the body at any given moment. And so what they did was it's kind of cruel that they did it, but they provoked kids with sensory stimulus, so like loud noises or light or touch, to see what changed within the autonomic nervous system. And so what they found is that those that had poor vagal tone, or the vagus nerve being impacted, had a higher stress response to the stimulus than those that didn't have poor vagal tone. So they did baseline, and then they did it under stress, and then they actually did it again at rest to try to see how long it took them to come down after the stressful stimulus. And so the research goes a little bit more into more of like kids that were diagnosed with sensory processing disorder, but those primarily that had a significantly harder time coming back to baseline after the big stressful stimulus. This is another really not great one that they did, but it was on rats, not people. But basically what they did was they had a controlled group, what's called a vagotomy, and then a one where they put a vagal nerve stimulator in. So there's a group of rats where they actually like severed the vagus nerve. There's a group where they put a stimulator in it that a lot of times they'll use for like seizures and things like that. And then there's one where they did nothing. And so the one that they cut the vagus nerve, they actually saw really big digestive issues as well as significant intestinal inflammation. But the ones that they put the stimulator in, they actually saw the opposite of it. So less inflammation within the gut, less inflammation from a systemic perspective, and then better motility of the gut. So things like plumbing out, basically. The cool thing is that there's ways to turn on our vagus nerve that don't require us getting something surgically implanted into the body. You guys have this in your folders as well. It's something that I like to share with parents to connect the dots with all of the pieces. So the vagus nerve does a whole lot. It's a big portion of our central and autonomic network, but it also plays a role to our immune system as well as to gut health. So it's a big key player in the plumbing, or the motility, the movement, and the drainage. This shows up with both of our digestive system, but also the immune system as well. And so A lot of times what I'll see in a lot of these kiddos is that things are either way, way overactive from an immune system standpoint, or they're very, very suppressed, meaning they're not necessarily having the immune responses that are necessary. But as we talked about before, the vagus nerve is the most impacted by things like birth trauma and interventions, chemical stress, and then maternal distress, but it plays the biggest role when we start talking about growth, development, socialization, the ability to like calm and regulate, but also like a big deal with our emotions. This is that fourth, I think this is actually the 5th D on the pathway, but this is what the fancy word of like the energy expenditure. So it's a reversible pathophysiological state where essentially there's energy errors, either too much or too little. And both of those are not a good thing. And it's actually something that we measure within the office. This is one of the Ds that are 6 through 10. This is probably the most important when we start talking about seizures or autism. And it's this idea of what's called developmental diaskesis. So it's a loss or a change of function in one part of the brain that then affects another part of the brain. Whether how close it is or not, it's a part that's connected. So the biggest thing that I'll see with these kiddos is that we're either way too much in our survival brain or our brainstem, or their cerebellum or the filter just doesn't necessarily work properly. So the amount of information that's then flooding the brain is incredibly overwhelming. It's a big portion as to why like social situations or places like this may be a little bit too overstimulating for a lot of these kiddos. The filter just isn't calming things down like it does for us, because there's kids in the back, the AC is kicked on a couple of times, people have gone in and out, but it doesn't really bother us because our filter works pretty well. This is a big study surrounding autism, and so what they really look at, especially from a birth intervention standpoint, is the impact and injury to the cerebellum, which then alters the circuits primarily to the prefrontal cortex. The cerebellum is what I find to be the most impacted by a lot of these kids, as it affects their motor movements or their ability to understand where they are in space. So these are the rest of the Ds. So there's developmental diaskesis, there's distortion of the neurospinal system, disruption of communication, which then leads to disconnection and then damage. This is a big part of the diaskesis sort of pathway, is that there's an alteration to where the information coming into the brain is coming in. There's the injury primarily to the cerebellum, which then goes to our thalamus, which is basically like air traffic control, which then sends all the information everywhere else. So if the information coming into the brain is more stressful, it's going to go straight to that amygdala we talked about, as well as the hippocampus. And so that will then push the fight or flight response a little bit deeper. But the way that that happens, especially when we talk about altered input into the brain, comes from a genetic standpoint, stress, and then the environment. This is a little kiddo that was shared by a big mentor of mine. I don't really have a lot of videos of kiddos, just because parents don't like videos of kids, which is fine. But this is a kiddo that was very, very disconnected and dysregulated. It's actually really interesting.
Hi, Kristen.
It's really loud. What's really interesting with this kiddo is the amount of vestibular input that he's getting from the car ride itself that actually like calms him down and down regulates. You see the same thing, or I will see the same thing with a lot of these kiddos that are mega dysregulated with screens and tablets. As essentially it's a whole lot of input that's shutting off the visual imagery portion of the brain, or like the processing centers, that they don't have to create their own reality. They don't have to create their environment because something else is doing it for them. Vestibular input works the exact same way. And so, as you can see, basic questions or basic conversation is causing him to lose his marbles in a situation that shouldn't necessarily be that. And this is a follow-up video that they shared where he's got some speech issues for sure. There's a couple of speech therapists I'd love to send him to. But this is a completely different kid. You would never know that like just basic questions would throw him off like it did in the previous video. Those words are a little too close. One of the big things that I talk about, especially with some of our littles, because I see it more often now than ever, is big changes to motor milestones. So what you're seeing here are pictures or images of some of the neurometrics that we take on kids and really all patients within the office. And so essentially it boils down to where and how much stuck stress there is onto the nervous system. So this one is what's called thermography. So it's looking at irritation and inflammation. These three are different views of the same exact test, and that's looking at the dyskinesis portion of it, or the abnormal energy expenditure, too high or too low. And then on the far right is what's called heart rate variability, or it's a direct measure in the gold standard of looking at vagal tone, or essentially the function of the autonomic nervous system. There's gonna be a couple kids that I share with you all. This was a kiddo I think I've been seeing for the past 2 months, born at 26 weeks. He's done about a year of PT. When he came into my office, he was about 13 months old and still not rolling and still not crawling, let alone all of the other big things that come into it. The pediatrician basically just said he was low tone and that he'll grow out of it. But if you remember from our perfect storm pathway slide, kids don't necessarily grow out of issues, they grow into bigger and different ones. We just call it by a different name. And so he was doing intensive PT, wasn't really getting anywhere. The mom ended up finding I think it was my social media or my Google or something. And she was like, I've heard this can help, let's see. I told them verbatim the first day that I met them, I was like, your PT is gonna start asking you questions as to like what the heck that you're doing. And so literally within the first 2 weeks, he rolled off the bed actually. My wife calls that phase the potted plant phase, where you can just kind of like sit them somewhere and then they don't move. So he was in that potted plant phase a little bit too long, and so they weren't really worried about him like moving and stuff, and he ended up rolling off the bed, which is fine because I fixed it after. But within the first 2 weeks, he was rolling and crawling, and his PT ended up messaging me. He was like, what the hell's going on? I'm like, he's connected. He has a bigger foundation to kind of like move through, right? He's more supported from a neurological standpoint. And so these were some pre and post that I did with him. He was also going through a lot of sickness stuff during that time, which is not uncommon for a lot of these kids, especially if things are draining a little bit better from the ears, nose, and throat. Sometimes they'll get a little bit sick. But really big, massive changes in terms of waking up the neurological system. This is one that I'll look at for depth, or chronicity is not really a word that I like to use because there's a lot of fear behind it. But essentially things were more stuck or sympathetically dominant. And whenever we start looking through, which kind of follows suit with a lot of his motor milestones, things were waking up in a really big way. And his parents were seeing that too. And so what was really interesting was like him like laughing and playing and doing all the cool stuff that kids do within the office. The other big thing was they had gone to every GI specialist. They had tried every reflux medication that they could get their hands on. Nothing worked, as most of them don't. And they actually suggested putting him on a G-tube and a G-button actually at the time. The parents really didn't want to do that because he was making such good headway and they didn't know the long-term effects. But one of the things was he actually stopped refluxing, which was really fantastic. And then he was finally putting the weight on, and the pediatrician started asking questions. But for the most part, pediatricians don't like chiropractors. There's reasons for that, but it is what it is. Typically for kids 3 and under, I usually only do thermography, which is the irritation and inflammation. Sometimes I'll do heart rate variability, but they move a lot more than I would like them to, so I can't really get good data on them. But this is typically what I will see. And so for this one specifically, on the left-hand side, you're seeing a big amount of irritation and inflammation to one of the most delicate and underprotected areas within the entire spine. And what you're seeing is a big change to the pattern within the neurological system on the right-hand side. This is my little buddy, Jack. I had a lot of speech therapists get really kind of frustrated with me with this one. But when Jack was about 18 months old, he fell from the second story in their house, landed flat on the back of his head, fractured multiple bones within his skull. And then mom says, by the grace of God, that there wasn't anything wrong. There was a concussion. They couldn't see a big TBI, nothing like that. But when he was 2, he started developing a stutter, or it was like a big block in language. And so mom didn't really know what to do. There's some friends that that we both have, like I hadn't met them prior, but they were like, go see Dr. John, go do something, try to figure out if there's a direction that you guys need to go. And so whenever we looked at his first set of, and this is his first set of scans, things were very significantly sympathetically stuck. So this fight or flight system, his body's working really, really hard, and it's actually pushing more towards exhaustion the lower that you go onto that graph. But the biggest thing that was impacting for Jack was the upper neck, or what's called a counter rotation pattern within the upper cervical spine, which massively impacts the vagus nerve. So he had some gut issues and some sleep stuff, and then the big thing that mom was really focused on was speech. And it was really funny because I was sitting there adjusting him one day, and his mom, and we were about 2 weeks in, I think, into his care. And the mom was like, I didn't really know how to bring it up, but like, I haven't seen his stutter in about 2 weeks. And then at about 3.5 weeks into care, like his stutter was completely gone. And that was like right before Christmas. So he's still stutter free, which is really, really fascinating. But a bunch of speech therapists got kind of sticky with me because they're like, you can't handle speech stuff. I was like, I just clear out the plumbing. The body does the rest. This one was a really cool case. Ryan is a 4-year-old kid. The way that I describe him, his mom describes him this way as well, is he's kind of like a Clydesdale, where he's like too big for his own body, or like those little puppies with the really, really big paws. That's Ryan. So lots of gross motor, fine motor issues, speech, drooling was one of the big things that mom was really focused in on. And then behavior and emotion. She was actually thinking about trying to get him a diagnosis of ASD. 1, because she wanted the resources, but 2, she just wanted answers. And so these were some of his progressions throughout care, where like, I mean, I think it took about 2 months for him to actually like lay on a table. Most of the time he was at that couch in the front room or climbing on this little pickler triangle thingy, which is really difficult to do if you've never adjusted a 4-year-old who's too big for his body in an office. But he was a mess. He was really fun to take care of. But one of mom's biggest goals was like getting him ready for kindergarten, because she thought that he was going to get made fun of because of the drooling, the speech issues, him just being very clumsy and uncoordinated. And so one of the things that mom shared with him was like, 1, his speech therapists were shocked. His OT was super shocked. His sleep, his emotional regulation. He actually had a fear of going to the restroom by himself. I don't know if it was like the light or the toilet or whatever. It was so weird. He did it in the office a couple of times. And then there was a handful of times, like whenever I was adjusting him in office, that he just like got up, ran to the restroom, went to the bathroom. And his mom and I are just kind of like sitting there looking at each other like, did that just happen? She's like, I don't know. I'm not judging it. But the big things that were a really big bother for mom was the notes home from school of like biting and scratching and not necessarily being able to socialize super well with kiddos. And like, I mean, the kid hasn't had a bad note from home in the last like, I don't know, 3 months or so. It's been really insane. And so the mom was like, this has been a massive missing link to him, because they've exhausted all of the things. They did PT, they did OT, they did speech, and they were just hitting walls with all of the things. Especially when I talk about ADHD, there's a couple of different types. And if you get into clinical criteria, I think there's like 8 types of ADHD now. I always just like to talk about it of like raging bull, drunken bull, or mixed between the two. This is when we start talking about the dyskinesis again. So activity within the body that's either way, way, way too high or way too low. Usually you'll see this with hyperactive or the very down, dysregulated kiddos. A lot of times the clumsiness usually shows up on the drunken bull side. Ryan is one that I would consider to be a drunken bull. And then there's a mix between the two, which is usually just a roller coaster between really, really high highs and really, really low lows. One of the most interesting cases that I've seen in my career was a kiddo by the name of Thomas. It was a really, really sad case where he was a twin. He was the smaller of the two twins. The dad had a lot of like guilt and shame with all of the things. The big thing, which I had a talking with the school or his teacher because of it, because they were calling him a bad kid. I'm a firm believer that there are no bad kids. They just don't have the foundation to be able to do the things that we ask of them, especially within a school setting. But these were his things. I think that he probably should have had a diagnosis of oppositional defiance disorder, because he had a lot of stuff. But the one thing that he would tell his mom over and over was that his brain was just not working right. And so the big things that mom really wanted, because they had twins and then they had a little baby, was like she just wanted to be able to cope with the emotional stress associated. But like her and her husband wanted to be able to go to church, they wanted to go to the store, they wanted to be able to go to the park and play with other kids. And that was a very difficult thing for them to do. I remember, I will never forget this story. She said one of the worst meltdowns that he ever had was they were all getting home from school, and she went to unlock the door and then opened the door, and he wanted to open the door. And it was like DEFCON 5, like meltdown of like, because he didn't get to open the door, it was like the worst meltdown that you've seen in your entire life. So these were his scans in the beginning. So at the time, we could not do heart rate variability on him because he was just too dysregulated. But the amount of tone and tension that was in his little musculature, and the amount of like stress and fear within his little body, just going to a new place, seeing a new doctor. One of the things that I preemptively do for parents as well as for the kid is I typically would do a video of myself, kind of like getting them familiar with my face, showing them what the office looks like, what some of the testing stuff looks like, so that way we can decrease anxiety by increasing predictability, which is really important from a polyvagal standpoint. But none of that worked for Thomas, unfortunately. But one of the big things that we saw with him is like, as the stress and tension from his little body started to go away, is like the good notes from school started to come in, his bowels started to change really big, his sleep changed. And then what's funny with twins is usually the other twin will start to have issues when the other one starts to like heal and progress. It happens every single time from what I've seen within my career. But yeah, it was really interesting. And mom was like, well, now we have to like switch gears. And his sister's name was Annie. She's like, now we got to get Annie in to be able to fix all of the stuff. But this is Thomas. The funny thing about those little stickers is it actually made little adhesive marks that like stayed on his body for like weeks at a time. No matter how much they like scrubbed it and put essential oils on it, the like adhesive like stayed, and I felt really bad. But the crazy thing was, like, this was a kiddo that like couldn't go to the store, they couldn't go to church, they couldn't do any of the things, and he ended up going to an Astros game with his grandparents, which was like I remember sitting in the office, because this was when my wife and I practiced together at the time. But I remember mom was sitting in one of the benches, I think, at her office, and the mom just like nonchalantly was like, yeah, they went to an Astros game over the weekend. And I like looked at her, I was like, what the hell do you mean? Like, what do you mean they went to an Astros game? Like, it doesn't make sense. I was like, these kiddos couldn't go to the store or Target for that matter without like losing their marbles, but they just went to like this sensory overload experience of an Astros game. And she like didn't put the two and two together, but I was like trying. I was like, this is a really big deal. The other thing that was really interesting about this case was he was a kid that struggled with bedwetting, and that was actually something that stopped. It wasn't even a goal that she had for him, but it was something that stopped with him throughout the course of care. This one's a really sad case. He's a 13-year-old that I still see. He has ASD, CP, and pediatric epilepsy. His seizures have been non-controlled, even with the significant Keppra, which is a seizure medication, for like the last 3 to 4 years. So he does about 1,000 milligrams of Keppra 3 times a day. So like, it's almost like the lights are on, but nobody's home kind of a thing. It's really, really sad. But mom found about me through a speech therapist or a myofunctional therapist. And so over the course of his care, there's been a lot of ups and downs because usually seizures are pretty unstable, or seizure cases are pretty unstable. But it was interesting as we would go like 2 weeks without a seizure, and then he would have a small absent seizure. Then we'd go like 6 to 8 weeks without a seizure, and then he'd have another little one. And the longest that he's gone without a seizure in his whole life now has been about 3 to 4 months. And so he'll still have like the small little ones, but they're not having to do the rectal emergency meds for his seizures now. And so mom's just like, this is insane. His name's Pierce. Basically the mom was like, I don't know what's wrong with him. I was like, okay, we can talk about it. But there was a lot of prenatal stress, a lot of birth issues. She had a lot of mental, emotional things. There was a couple specialists that I was trying to send her to for him, but it was really for her. But the biggest issue that they had was like, basically, if you think about like witching hour for like a school age kid, like that was it, where he would get like these massive second, third, fourth winds of energy and just like not be able to calm down. But I think it was about two weeks into getting him adjusted, and like the parents finally had like a night to themselves kind of a thing where they like got to like watch a movie and like eat dinner by themselves without a child running all over the place. Oh, this is a big one. So we talked about dysautonomia and how that's more of a medical diagnosis. Basically, it's kind of a throwaway diagnosis because they don't know what's going on. But this is a little girl by the name of Kendall, who I've been seeing for the past couple of months, that has long haul COVID. So extreme exhaustion, extreme fatigue. She was a competitive dancer in a really, really big way. Like the plans were like college dance and all the things. After she got wiped out with COVID, basically none of that happened. It actually created a lot of PTSD with dance. And so one of the big things that's changed with her over the last few months, she's still not doing competitive dance, but she's going to dance classes now without her big old PTSD response from it. It's been absolutely insane. And she's not the moody, exhausted teenager that she was. This is probably one of my favorite cases over the years. It's still wild to me every time I talk about it. But this is Grant. So Grant's mom had a very significant, stressful pregnancy. She's a department chair for a big university outside of Houston. They ended up having an emergency C-section. He was diagnosed with infantile spasms, which is a type of pediatric epilepsy. So he was given seizure medication since birth. He was ended up diagnosed with nonverbal autism at about 18 months because his mom was doing a lot of research within autism. So he was in ABA, PT, OT, speech, all of the things from about 2 years old. Within the first couple of months, he started pointing and making eye contact, which is big for, if any of you guys know, like big characteristics of autism. And the really interesting thing was like, I started noticing it in the office, and I started asking mom questions like, how is he at home? Like, what are the things that you guys are seeing? He's like, he's more enjoyable to be around. He's playing with his older brother more than he ever has, and like we're just all kind of like dumbfounded with what's going on. I celebrated the heck out of it. The mom didn't really think it was too cool, but he ended up testing out of ABA. So he went from 4 days of ABA to 3 days and then to 2 days, which again, I celebrated it. The mom was like, it's a logistics nightmare because we all have to work and all the things. I was like, it's still cool. But we worked really heavily with his neurologist, which she's one of the coolest neurologists that I've met in Houston. And she was actually open to me adjusting him, because usually neurologists also don't like chiropractors, along with pediatricians. But he ended up halving his dose of seizure meds. I think it was about month 3 into care. And then he's been completely off seizure meds since. It's been absolutely insane. And then the coolest thing happened is he was in the office. My wife was adjusting him that day. And he actually said his first word in the office. And it wasn't mom, it was the color yellow. But like everybody was crying, like I was crying, my wife was crying, his mom was crying. Like it was the most insane day. But yeah, this is one of the coolest cases that I've ever seen in my career. So to give you guys some stuff, because these are a lot of my favorite resources. Probably the most research that you will ever see surrounding the nervous system and autism, or really any condition for that matter, is within the textbook of human adaptability. A lot of it is based off of heart rate variability, or that one that tests the balance between sympathetic, parasympathetic. Healing the new childhood epidemics is a big one. It talks about the 4 A's, so asthma, ADHD, allergies, as well as autism. It's kind of a racy book. There's some really interesting things in there, but it's really good. One of my favorites, especially from a parenting perspective, is Reconnected Kids, because there's a lot of really great parenting pieces in that, especially for caring for kids with neurodevelopmental disorders, as well as The Whole Brain Child. It's absolutely one of my favorite reads for parents. My go-to for a lot of these kids on the spectrum, or even ADD, ADHD for that matter, is implementing some of the principles of the GAPS diet, or the gut and psychological syndrome diet. And then one of the big resources that I always share for ODD is what's called the explosive child. And it gives parents the resources to be able to handle some of that stuff. So the big thing that I always share with parents is keep seeking answers, because essentially the questions that you have that aren't getting answered, and the reason as to why you guys like made it here was because you guys are looking for more answers for your kids. And so the one thing that I always share, which is a little bit bold of me, but if your provider is not giving you the answers that you're looking for and not able to answer your questions, it's probably time to find a new provider. The biggest factor with that is continuing to ask questions, because that's ultimately going to lead you to the answers that you're looking for, as well as the help that you guys need. From a chiropractic standpoint, reducing and limiting, removing as much of the stressors onto the body and the nervous system as possible. So physical, chemical, mental, emotional, and then technology. And then the one thing that I specifically do, and the only thing that I could offer, is getting your child scanned. Understanding what's going on within their nervous system, being able to measure that, so that way we have an idea of what we need to do moving forward to get them out of this storm. So I always give parents the opportunity, because parents always ask whenever we get done of like, what does it look like working with you? I always do a big clinical process coming into the office. Sometimes it's a 3-step, sometimes it's 4 steps. Typically with older kiddos, I prefer to do virtual consults with the parents, so that way we don't speak things over the kids. There's just some things I don't like to talk about in front of the kids, where we go back through all of the things. What was preconception like? What was pregnancy like? What was labor and delivery like? And then what have the things happened from now to then? Doing the scans, or actually getting the neurometrics on what's going on with the body, how much stress, where, and how deeply it's embedded into the nervous system, to then be able to figure out how to get them out of the storm. And that's what the report and the care plan piece of it is. Parents always ask, how long does it take? It depends for every kid. Typically, the younger that a kid is, the easier that it is to kind of get them out of it. The older that a kid is, the longer and more intensive sometimes that can be. One of the big questions that I get from parents all the time is like, how Will you ever get my child to sit still? The answer is we don't. We do snow angels on the floor, or I adjust them on the little triangle, or on the couch out in the front, or sometimes even in the car. I've adjusted kids in the car because they won't leave their car seat. So short answer is we don't, and we don't have to, and that's absolutely okay. Parents always ask, what the heck does a pediatric adjustment look like? So this is a short video from my Instagram that I did adjusting our son when he was in the office one day. He's really cute, by the way. It's perfect for Instagram, baby model. So one of the big things that's super important is being very, very specific with what we do. So utilizing the handheld thermometer allows me to understand and measure dysautonomia within the upper cervical spine. That little yellow piece that was around my neck is how we adjust them, because there's no popping, twisting, clicking, or anything like that. For kids, it's not appropriate. There are special circumstances, but traditionally that shouldn't be the case. And then finishing up with whatever things. Typically, like I said, there's no big manual adjustments.